What's up, everyone? My name is Dr. Mo and I'm a dentist. Today, we will see the process of cleaning a dental cavity, a tooth cavity, and filling it. I'll be providing commentary along the way. Put a like on the video and a comment. It helps to push the video in the YouTube algorithm. Okay, so from the X-ray, it looks like very deep cavities. Take a look at the X-ray. So from the X-ray, it looks like very deep cavity in very close proximity, okay, to the pulp space. This is called the pulp space, which has the nerve, the neurovascular structures, and other cells, and extends into the root. This is called a coronal pulp space, called radicular pulp space. This is in relation to the root, and this is the coronal portion in relation to the crown, okay? And as we can see, the cavity is very deep. Okay, so first what they're doing is they're checking the clamp, if it's a suitable clamp. What is that metal thing called? It's called the rubber dam clamp, and this is called the rubber dam sheet. So we check the clamp first, if it's a suitable clamp or not, and then we use it with rubber dam. However, one thing that was missed here, I guess, and it's for safety precaution, is that I would tie the rubber dam clamp with a dental floss. Why is this? Because in rare cases, or I don't want to say rare, but there's possibility that this metal clamp may drop from the dentist or operator's hand, and actually the patient can inadvertently swallow it by mistake, causing potential problems and complications. In an event that, God forbid, happens, then I could pull the rubber dam clamp, metal clamp, with the dental floss because I made a tie. Okay, so they're washing the cavity. They're starting with manual excavation. But I will tell you I'll tell you something that's really important, and that is prior to doing all of this, considering, for example, the tooth is vital and is alive, there should be some tests like cold pulp test that we do to help assess the vitality. Also, if the patient has some mild or more advanced symptoms on the tooth. So what does that mean? That means also we're giving local anesthetic, okay, prior to the procedure. This looks like a spoon excavator that the dentist is using. What they're doing is they're excavating the bacteria and infected dentine, which, as they clearly wrote here, they're soft, okay? They're soft, and they can rather be more easily removed. It does look like a very deep cavity. So another way to do this is there's a particular handpiece that's called the low speed handpiece, and we would apply a round burr or round shaped burr to it. So it's like a lower speed drill, if you can consider it that way, and we can remove those caries slowly. So they're saying can be prone to fractures. It is a true. So as you can see, we have that, we call it an X-ray, we call this a radiolucency, this one, okay? So we have radiolucency in close proximity to, very close to the pulp. Just, they're commenting, just look how close to the pulp that is. Okay, so what that is called is a caries detecting dye. It helps us identify or mark certain areas of caries to help us in the removal process. Excuse me. Right, so if you remember a bit earlier in the video, I did say another method for caries removal is through the use of a round bear. By the way, it can be a low speed or high speed, but because we already accessed the cavity, meaning we're inside the cavity and we're just cleaning that soft dental decay and caries, they're going for a lower speed round bear. Look at the technique in removing the caries from the most superficial or the outer areas and going gradually into the deeper areas. I don't know if this dentist will go in this sequence, but if yes, then it's a decent technique. Why is this? Because the areas that's most centered and deepest, these are the closest to the pulp. In an event where the drilling opens into the pulp or perforation happen into the pulp happen, then we're at very high risk to needing a root canal procedure instead of a rather simpler filling procedure. So they're saying it's better to start inside, which is what I was saying, meaning from the most, we call them the outer layers, and then gradually progressing deeper, eventually through the middle. And also, while we do this, it's very gentle touches and very gentle use of the handpiece itself. We're not pressing aggressively, we're not doing any of these things. They just said the center of the tooth where typically the pulp is. Of course, there can be variation, meaning it can be slightly to the side or slightly to the front, but generally speaking, the pulp is roughly around the center of the tooth. So they just said this actually takes a lot of time, and it does. So when a dentist takes long period of time with filling or with a procedure, it doesn't mean that this is a less skilled dentist. In fact, I would argue it depends on why they took more time, but that is actually a dentist who's being more careful and more cautious and has the patient's interest up more first. Yeah, so they're saying would not want to expose the pulp. Why is this? Because in an event where we expose the pulp, we're moving to mostly a different procedure. Yes, there are managements for pulp exposure. We have things such as direct pulp capping, and there are means and measures to this, but generally speaking, especially if it was a carious exposure and a big sized exposure, and by the way, big in dentistry terms is like some millimeters, then we may need rather a root canal. So exposing the pulp can cause this death to the tooth. I do agree with this, yes. This is how slow we do it. I said we don't want to go fast and aggressive. Slow is fine as well. So finally checking with any soft dentin, again, this final step, some restorative dentists that I work with, I'm not saying this for everyone, I may disagree with this because spoon excavator is actually quite sharp, and hence it may pierce a very thin layer of dentin into the pulp, okay? So they're removing the thin and sharp edges to the tooth. This can be annoying to the patient. This can be also, if it's a very thin edge, it can be fragile and more prone to fracturing. Nice and clean, yes. Okay. So now they're starting with the steps of the actual filling itself. They're starting with etching the enamel. Whoa. Okay, so there's some different techniques to this, also depending on the type of restorative materials used and components. But I don't etch the entire thing. I do selective etching. So I etch the enamel only, and I have very advanced bonding agent, which what you're gonna see next, that is applied to the dentine and to the enameled. This etching of the dentine, they're using mostly an acid etch. I don't know if they disclosed which material, but the one typically used is an acid etching. In that way, okay. So then they're saying cleaning the cavity with chlorhexidine. Like, so they're applying a dentine primer. After applying the dentine primer, you can see they're applying air as well, and then they're applying strong adhesive. So they're saying this bonding system does not cause tooth sensitivity, at least what the dentist is saying. Okay, then they light cure it, because all of these materials they're using, it needs to be light cured afterwards. Even when, if they will apply a composite, which is what I assume they will be using, the tooth colored filling, even the composite itself will be light cured after applying. So if you look at the first layer they're applying, they're using something called as a flowable composite as the most basic layer, because they wanted to flow easily into all of these small regions and any small parts, to not miss them if they would have used instead a packable composite. Okay. Also, I like to put a flowable layer to provide some sort of like seal from the area that's very close to the pulp, and then I progress with the packable composite. So what we learned is we have two types of composites primarily. So we have the flowable and we have the packable. Of course, composites can be categorized into many categories, but it's not our topic today. I'm just much oversimplifying things. Okay, so now it's sealed, which is what I said. I would put a composite layer to help seal the region. Looks good. Okay, so they add another layer. Okay, they're adding more composite layers and packing them. So they're saying this cavity is big and more prone to shrinkage. I would argue also because there's a lot of tooth surfaces involved from the inside. We need to gradually fill this cavity during the build-up. So they're saying we have to place one layer at a time. So gradually, layering technique. Okay, so they're adding grandio, a heavy flow type. To be fully honest with you, as a dentist, I'm not too sure if I need to use that much of a variety of dental composites. I'm not criticizing what they're doing. It's if it works with them, then fine. I'm not saying it's a bad thing. I'm just saying I'm not really using that much of a variety. Like I have flowable, packable. Yes, I have some things for deeper areas and so forth. I think it would be more time consuming and just having a more like number of materials in the clinic. So they're trying to recreate the original anatomy of the tooth. Now, of course, that really nice anatomy is going to be adjusted when we check for the occlusion. Remember that paper that the dentist actually articulating a paper or thing that they use and tell you to bite on it and then they adjust the filling. This is what we will do afterwards. Okay, so they do staining. They're saying it's not necessary. It's quite a bit of an optional thing. They want the result to be more natural. Hopefully, dentists there can differentiate easily between stains and actual decay, like cavities. Okay, it looks good. It looks good. What do you think? Tell me in the comment section below. Okay, so we remove the rubber dam clamp, we check the occlusion, and we start to do adjustments on the tooth. I'm not too sure. Okay, so I'm not sure if there's an opposing tooth to it, but they just did slight adjustments to another tooth in the opposite part. Okay, so there are some teeth including to it. So it does still look like very deep filling. I guess this is an post-operative X-ray. That's all for today. My name is Dr. Mo Dentist, and thank you everyone for watching. Dr. Mo Dentist out. Don't forget to like, subscribe, share this video.